Welcome back to Inside the Issues. I'm Alex Cohen, coming to you from my home. From the beginning of this coronavirus pandemic, health experts nationwide emphasize the need for contact tracing as a way to limit its spread. Recently, the team at CalMatters has been looking into how this is played out throughout the Golden State. Take a look.
We're contacting you because your name was provided to us as possibly having been exposed to a person with COVID-19.
That's Marissa Cohen. She's part of California's effort to contain COVID-19 through interview-based contact tracing.
These are simply disease detectives.
But as case counts surge, some are wondering whether California's efforts are enough. True, Victor, Marissa, and Sonali work for the Los Angeles Department of Public Health. They have more than 40 years combined experience in the Division of HIV and STDs program. In March, they were redeployed to do COVID-19 contact tracing.
When we first started working, because everything was brand new and everybody was just in emergency mode, we were working 14 days straight and 12, 15 hours.
It was kind of just, jump in and start doing it.
It was like, oh my gosh, like, is this how it's going to be?
Because there is a stress around cold calling strangers and talking about personal things.
This has gone beyond anything that I've ever done. The fear or anxiety that people may have when they're on the phone, or even anger.
It's not a completely new thing that's going on. It's just, I think, the first time a lot of people are hearing about it.
The patient interview has two parts. First, contact tracers educate patients on how to isolate themselves for 10 days. Then, they ask patients to share the contact information of people they exposed to the virus.
Everyone sort of clams up a little bit when you ask about the names of the people that they may have been in contact with, their phone numbers, their maybe date of birth.
A lot of times it's jogging someone's memory.
Did you maybe see your family? Did you go to a picnic?
They may think of one or two more contacts that they can give me.
After the interview, tracers reach out to the patient's contacts to let them know they've been exposed to COVID-19 and help them quarantine for 14 days.
I've been fortunate to reach so many people, but it's only because that person decided to pick up the phone when I called.
We try people over 3 days.
But after 3 days, we're supposed to close the case.
For more on this, I spoke with reporter Ana Ibarra, who began by telling me how contact tracing has worked out outside of LA County.
What we did is we surveyed 38 counties. These are the counties that have been on the state's watch list, to ask them about, what they're doing in terms of contact tracing, whether they're reaching out to everyone or who they're reaching out to. So we found that while most counties are trying to reach out to the cases and reach out to their contacts, some are actually only notifying some contacts, or only notifying or interviewing some cases because of the lack of resources. The resources are stretched thin, they're overwhelmed with a high volume of cases. And so they really sort of have to prioritize who they investigate and who they reach out to, or which contacts they reach out to. So you have some counties who prioritize outbreaks and people in congregate settings. And then you have other counties who really only reach out to workplaces or the contacts in workplaces, as is the case in Merced County, which we found is one of the counties doing some of the least contact tracing. But again, most of the counties are trying, at least, sometimes they are periods where they have to triage those resources, but most say they are trying to reach as many people as they can.
I'd love to talk for a moment about Orange County, because it's in such close proximity to Los Angeles County, but a very different approach there, as you and your colleagues wrote. They're basically relying on people to be their own contact tracers, so to speak. How's that working out, and what are some of the potential downsides of that, not leaving it in the hands of professionals who've been trained to do this?
Right. So in Orange County, as you said, yes, they do rely on some of the infected people to notify their own contacts. And what that means is, not all people will actually do that, or, you might not have that data, for the county might not be able to collect that data as to how many people are actually being contacted, how many people who were exposed are actually being contacted. So yes, it's hard to sort of collect that information when you're leaving it up to the infected person to do their own tracing. Also, there are certain questions that contact tracers ask. They follow a very strict prompt from the CDC, and those are questions that people who are infected might not be asking. They might just say, hey, I tested positive, you should get tested too, which is a goal. But, there again, you're not collecting all the information that is prompted by the CDC.
One potential advantage of having the individuals themselves who have tested positive call the people that they know is maybe those people are going to be more likely to actually pick up the phone, as we saw there in the video. Some people are just not answering those calls from public health officials here in Los Angeles County. They've actually recently added an incentive. If you pick up the phone and answer the questions, you get a $20 gift card. I mean, that to me kind of shows a little bit of desperation. Why is it? What has your reporting found, Ana, when it comes to why people are not answering the calls of these disease detectives?
Yeah, so it could be for various reasons. I've talked to some local health officers who say we're relying that the number this person gave us is the right number. One, it's the lack of information. Two, also there is a barrier of trust. Not everyone wants to talk to someone who's calling from the government or identifies from calling from the county or the city. People might not be aware of, or other people are afraid of. We're also hearing about scams. In LA County, actually, they've reported some scams. So people are there's a lot of trust issues. So some people might just opt out and not want to participate. They either don't want to fall victim to a scam, or they just don't want to give information. A lot of people are very afraid to share their family's information. As well, one health officer told me, which I thought was interesting, was some people, especially if they attended a party or some sort of family gathering, they're ashamed to share that, to admit that they did that. So they just would rather not participate.
Yeah. There's another big challenge here when it comes to contact tracing, and it seems like this is happening throughout the state, and that has to do with the lag in between the time that someone gets tested and the results. How is that impacting the situation?
Yeah, so that is definitely probably the biggest frustration we heard from counties, is that, the whole point of contact tracing, or contact tracing really is only effective, they said, if you have quick testing and quick test results, so that you can actually catch people at a period where the contact tracing can actually make a difference. So if you have someone who is being tested and the results don't come back 10, 14 days later, you're now having to ask this person about their contacts from 10, 14 days ago. And really, that's harder for people to remember. Also, you're now, that period, this person who was exposed has been out and about. So really, it's not making much of a difference at that point. Those are some of the contacts that some of the counties, like Riverside County, for example, is not tracing, or it's not reaching out to, because they say, if somebody is getting a test results 10 days after, we're not making much of a difference, so we're just going to pretty much let those go. So yes, tracing, in order to do effective contact tracing, the key is rapid testing.
And be sure to join us here each Wednesday as we hear from great reporters like Ana Ibarra working at CalMatters to cover the Golden State. CalMatters is also one of our editorial partners on the brand new Spectrum News app. Go to spectrumnewsapp.com to learn more about the app, and be sure to download it now.